From Wish TV and the All Indiana Podcast Network, this is the Business, Equity, and Opportunities Podcast with Scott Sander.
Welcome to the Business, Equity, and Opportunities Podcast. I'm Scott Sander. On this episode,
CICELY Overton is the Director of Nursing and Clinical Practice at Eskenazi Health. She's dedicated to recruitment and helping build careers.
Every business is unique and has a target audience. If you own or manage a business, Circulus Digital Media can help you connect and grow your customer base with turnkey digital solutions that are nimble, offering best-in-class results, service, and support to reach a bigger customer base, allowing you to pinpoint a specific audience down to the smallest details. Get outside the city, the state, span the globe. Put Circulus Digital Media to work for you. Get started now at circulusdigital.com. That's circulusdigital.com.
This message comes from Greenlight. Ready to start talking to your kids about financial literacy? Meet Greenlight, the debit card and money app that teaches kids and teens how to earn, save, spend wisely, and invest with your guardrails in place. With Greenlight, you can send money to kids quickly, set up chores, automate allowance, and keep an eye on your kids' spending with real-time notifications. Join millions of parents and kids building healthy financial habits together on Greenlight. Get started risk-free at greenlight.com/Wondery.
This is Business, Equity, and Opportunities. Industry Focus.
I am CICELY Overton. I'm a registered nurse. I'm the Director of Nursing for Primary Care at Eskenazi Health. I have been here for about 20 years. In this capacity, I have been in about less than 2 years. So when I first started my nursing career, just to be honest, I didn't know what I wanted to do. And so when I graduated high school, my mom was like, "You need to figure out something." So I became a CNA. So I worked as a CNA, became very passionate about the elderly and what I was seeing happen with the care that they were receiving. So I worked as a CNA for about less than 5 years. Then I became an LPN. My plan was to be an LPN for 1 year. I worked as an LPN for 13 years, and then I became an RN. Once I got my RN, I went through all the steps. I got my associates, then I went back and got my bachelor's, then I went back and got my master's. So I got my master's in nursing with a focus on health informatics. So one of the biggest things I've seen here recently, Eskenazi is really priding themselves on having a workforce that mirrors the community that we serve. And I think that has been huge in improving health outcomes and making people feel comfortable and know that they are receiving quality care here at Eskenazi. There was a study done in 2021 of 104 zip codes across the Indianapolis area, and it was identified that there is a 17-year life expectancy difference from those living in vulnerable areas. So I think Eskenazi does an excellent job on priding themselves on identifying those populations, actually putting our clinics in those communities, and being able to provide the care that people need. So there's job fairs that we host, and different with nursing, especially with nursing going into the nursing schools. HR does a fantastic job of connecting with nursing students. Just within the last 2 to 3 years, we have had student nurses in primary care settings. And so just yesterday, I was reading some comments from some of the students who were just stating how they were so impressed with the services that are being offered to people that typically wouldn't be offered these services. So we do a lot for our vulnerable populations, and people are recognizing it. Yes, I do. It seems there's more and more, we see more and more resources for our vulnerable populations. Like even here at Eskenazi, we've created teams. We now have community health workers, we have community weavers, and we have doulas to help with maternal health outcomes. So there are programs that are continually being developed based off of what we see the community is in need of. And partners come alongside different food pantries, different organizations to help victims of violent crimes and different things like that. So for me, what it offers is a sense of fulfillment, a sense of pride, a sense of joy that I've actually made a difference. For many years, I never saw myself outside of patient care. And a nurse colleague actually told me, she said, just imagine you are one nurse in one facility helping one patient at a time. But if you focus on a leadership role, you're helping the community. You're helping all of Eskenazi's patients. So that's how I was able kind of to pull myself away from direct patient care and know that I'm making a difference on a system level. So for me, my opportunity has been absolutely amazing here because, as I stated, I started as an LPN. In 2010, there was an opportunity for me to go back to school through a Workforce One grant where my schooling was paid for 100%. So I was able to obtain my obtain my RN from an LPN through Eskenazi, Wishart at the time. And it has allowed me to evolve into different positions, a position of leadership, like I said, that I never saw myself in. Just being able to, I've had a leadership team that has always poured into me and saw the value in what I was doing. And I've always felt like I've had a voice to help patients. And I think my voice is actually being heard now on a larger scale.
Our thanks again to all the contributors who joined us for this episode of the Business Equity and Opportunities Podcast. We hope you found it enlightening, useful, and inspiring. You'll find more information about the show on our website, BEOshow.com. You can watch Business Equity and Opportunities Sunday mornings at 10 on Wish TV or live stream it through wishtv.com. Each week we provide 7 full segments with topics ranging from how to get started and how to access capital to the day-to-day running of your business and questions about accounting and bookkeeping. We feature business news and trends and always share a success story from one of our contributors. Join us next time for more insights into the world of small business. Be sure to sign up for our Business Equity and Opportunities newsletter to get even more valuable, up-to-date information. And if you have any questions or you'd like to be part of our show, please email us. The address is beo@wishtv.com. We'd love to hear from you. I'm Scott Sander. Thanks for listening.
Watch the Business Equity and Opportunity Show on Wish TV and access all of our content and share it on demand anytime at BEOshow.com. You can find more podcasts from Wish TV on the All Indiana Podcast Network at allindianapodcastnetwork.com.